Hello, my name is CD Sar. I am going to discuss non-violent and violent crisis interventions that can be used to prevent the use of force, seclusions, and restraints, either physical or chemical, in our patients that are difficult, aggressive, and potentially violent. As stated by Tesla, Rez, and Dundas, the assault rate occurring across psychiatric career is approximately 40%. Rosak reported that the annual rate for non-fatal violent crimes against mental health professionals is 68.2% per 1,000 workers. And again, studies have shown that people with less training and less experience are less likely to recognize situations in which violent behavior may occur. They are also more likely to let patients' behaviors escalate to a violent situation. This stresses the importance of training for employees in non-violent and violent crisis intervention. First, training all staff will be the step that we will use, and all employees will have to go through a training program. Next, we will set up a care response team for responding to non-violent crisis situation, and activation of this will be done through a code purple. We will call it a code purple, and it will consist of the security personnel, a psychiatric doctor, or a physician assistant, and a nursing staff who are all trained in the crisis interventions and who will all respond to the code purple like a code blue team does in an emergency situation. As the head of the safety council, I believe crisis intervention starts right when the patient is admitted. Crisis intervention does not start when the crisis occurs, but it should start way before the crisis occurs. And important aspects in this will be: first, identifying the problem. What is causing the patient behavior? We will do it through medical examination and assessment by a physician and the nursing staff to establish the reason for such behavior. And the next will be, we will attend to the needs of the patient, either it's physiological or either it's safety needs, whether the patient is hungry, whether the patient is scared, whether the patients feel threatened. We will look into all those. And the next will be, staff safety is equally important, as we cannot care for our patients if we are unable to be safe. So have a safety plan, or have a safe exit plan when you're in with such patients. And the next is keeping the patient in a safe and quiet environment and avoid potential patient triggers that may cause aggression or potentially a violent situation. We will set boundaries, rules, and realistic expectations for these patients. Let the patients know that you are caring for them and you are there to attend to their needs and that they are in a safe place. However, let the patient also realize that they are bound by rules and expectations that are realistic. The need to consistency and a unified message is so important, and we have to communicate to these patients and avoid or minimize confusions. So we have only probably 2 people communicating to these patients, and the rest will be there to assist the staff. Provide a structured care and an environment with limited options. Also remember, give the patients a break to minimize the potential of the patient feeling confined or boxed in a situation which can lead to rebellion by such patients. An important aspect of all this approach will be verbal de-escalation techniques, which can be used with patients who are agitated, who are anxious, by engaging them through a therapeutic approach and coaching such patients by showing that you care for them and getting them involved in their own care and coaching them out of the anxious or agitated state of mind. And finally will be the activation of the crisis intervention team, which will be the code purple, which can be done by the nurse or healthcare team members if they feel that an early intervention is necessary. Again, the team can also activate this when all the above mentioned measures failed and the patient is already aggressive or violent situation. And finally, our evaluation plan. We will have a debriefment with the staff to go over each crisis and what interventions were done right or wrong and the way forward to prepare for our next possible event. And this can also help staff to express themselves and their concerns through staff interviews. Thank you very much.